Hi, I'm Ken Caper, and this is Dugan's Digest. Welcome to the show this week. This is part of the efforts of MemoryWorks to bring awareness to seniors and people with dementia about health and things that they should be concerned with. I did want to update you with a few things that we're doing. We just have published this month's, or I should say May's list of upcoming memory cafes. If you want that, you can email me at info@memoryworks.org. And we're also going to have a little bit of fun over the next month and a half. We're running a competition called Name That Old Tune to get seniors to get out and compete against other seniors, other teams for a grand prize, which we haven't fully chosen yet, but it's going to be substantial. And the winning sponsor will also get a piece of the action. So if you're interested, if you like to guess the names of old songs, or if you just like the old tunes, we had a chance to test this out at Huntington Commons last Friday, and we had 30 people show up and had a great time, foot tapping and singing along, and boy, it brought back a lot of memories, which is one of the things we like to try to do, is stimulate the brain and cognition. I also wanted to point out there's a magazine which I get from a friend. It's too expensive for me to buy, but I get from a friend who's very interested in extending their life. She's 95 right now, I think. I'm not sure how many more subscriptions she'll have, but it's called Life Extension. And this is the February issue, and the lead story is How to Halt Brain Atrophy. Now, I don't know if you know what atrophy is, but that's where the brain shrinks over time. And they talk about some natural treatments. And this is a pretty interesting magazine. I don't say that they're 100% right or 100% wrong, but somewhere in there's some truth to be had. And every issue has had something of interest to me. When I open a magazine and look at it, I'm looking for 2 or 3 articles that I wouldn't find anywhere else. So check that out, Life Extension magazine. I don't know if it's even in the stores around here, but it is very, very informative, especially on the issues around supplements and nutrition. So I want to introduce my guest this week, and I got to say, I don't impress easily, but I've been very impressed by the folks from Coastal Rehab. In particular, their founder and manager, director, owner, Natalie Deschanel. And Natalie is with us today, as is her associate, her OT specialist. There must be a more elegant title than that, Selena Carey. And thank you both for joining me today. Let me start out first of all by Natalie. Tell me what what I should know if I was in need of OT and PT services. What would Coastal Rehab offer me?
Okay. Well, we provide occupational, physical, and speech therapy, and we see our clients in their homes, and that can be an assisted living or independent living community. And we also have clinics in Kennebunk at Huntington Common. We have one at Scarborough Terrace in Scarborough, one in Cape Elizabeth, and one at Ocean View in Falmouth.
Wow, that's pretty good reach. So you actually have a physical presence in those 4. So you only have one office, but you kind of have 4 locations.
We have one main office in Cape Elizabeth and 3 satellite clinics where our therapist is really their home base, and then they go in a community and see clients in those areas.
So that's pretty accessible. I mean, you go to the patient, or you're giving people a lot of options.
Yes. Yep. So we see clients really all the way from Topsom to Kittery, so all of pretty much southern Maine.
That's a lot of territory.
Yep.
Especially Kittery, where you got to pay $6 to go down and
To
back
get on
just for the toll,
Yep.
Governor. But okay, so what does Coastal Rehab do? I know a little bit myself, but I don't think the folks watching may understand rehab.
Right. So I think most people know what physical therapy does. So I think the gray area is mostly speech and occupational therapy. I mean, we know that physical therapy works on balance, pain, strength, range of motion. So when somebody has falls or somebody just has a decline in their function, they can have physical therapy to reach their prior level of function. So the big mystery is what is occupational therapy. I think a lot of people, just the name is hard to explain what that is. So
Yeah, occupational implies job.
exactly.
Help with a job.
And what we do mostly is with geriatrics, and it's really trying to get people back to their highest level of function with their activities of daily living. So if someone's had a change with their bathing, dressing, toileting, they're no longer able to prepare their meals, take their medication on their own,
These
even
are
driving.
all OT?
Those are all areas that OTs address.
I
Did I
had
forget
no
some?
idea. I thought it was coloring books and interesting. So do you work with like brain injury
We work with
folks?
all kind of diagnoses. So
And dementia, Alzheimer's?
it's a lot of work with people with dementia because as the people progress in their dementia, oftentimes they lose some of those skills. So we try to focus on the remaining skills and do a lot of work with the caregivers and sometimes adapting the environment and the tasks so people can do as well as possible.
So how do I just call you up, or do I need a doctor's reference, or how do I know what I need?
Yeah.
I mean, certainly it would be nice to go visit an OT place, but if there's
Yes.
nothing I need.
So usually to
PT
get
and
started,
OT.
when somebody see a change in functions, either in themselves or their loved one, they can call the office, and then we can call the physician or fax the physician and get an order. So for therapy to be covered under insurance, we need to work under a physician order. But usually when people reach out to us, it's because there's been a change. If they're seeking to have therapy, there's definitely a need usually, and that's not a problem to get the physician to okay the
So
therapy.
you always have to contact the
physician, we
first,
do.
or have some sort of an order
Yeah,
from
we
them.
always work under a physician plan of care. So first, we just go and do an evaluation. Sometimes that's all there is. You know, if somebody doesn't really have a need, we can make some recommendations and that's
So
it.
tell me, what evaluation for OT and evaluation for PT, same thing, similar, different?
Yeah, I guess the difference between OT and PT, PT focuses more on the physical, and OT kind of is a little more holistic. So you really take into consideration the physical changes, the emotional, and the mental changes, I guess cognitive changes.
Okay. So what's involved? I mean, what do you must have a form you use to assess people and check
We
off
do all our documentation online. It's like called Web PT, so it's an electronic database system. So yeah, there's a lot to it because Medicare wants us to provide a lot of information. So really, you test like the balance, the strength. You look at how people are performing all their self-care. You have to look at their prior level of function, and then you establish a goal to hopefully meet that prior level.
And Medicare is sort of the people who set all these guidelines, or is this just something from the industry that's set up?
It's for the healthcare industry. I mean, nobody's going to want to pay for something if it's not shown to help. So really, we need to be able to show that we're making steady progress for an insurance to cover services.
So let's go back to PT for a second, and if I'm getting off track or if there's something you think is more important, please speak up. But my experience with PT, and it hasn't been, not with Coastal, but my experience with PT is my doctor gave me an order. I had a back problem, so he gave me an order for PT, and I would go in and spend 5 minutes with the PT, with the therapist, and he'd bend my legs and my arms and my back and stuff, and then he'd say, go into the gym.
Yeah, that's...
And I just thought for the money that I was spending, which was both the facility cost and the professional cost, I just thought 5 minutes or 10 minutes just wasn't doing it. So is that what you do?
That's not what we do. We usually spend, I would say, 45 to 60 minutes, probably closer to 60 minutes with all our patients. And it's all one-on-one. So sometimes if you're a younger person and you go to a therapy clinic, there'll be one therapist for several patients.
Yeah.
So all our patients are seen one-on-one, either in the home or in the clinic. We never have two patients at a time.
That can't be. I'm trying to think of how you make profit that way, because obviously if you've got one person who's seeing people for 10 minutes and then they can see 6 people in an hour,
Yeah.
that's really economical and you can make money off of that. But if you're seeing one-on-one for 40 minutes, that means you can see fewer patients a day.
Yeah, that's for sure. But
So I don't understand. I mean, so you're not in it just for the money.
no. No. And Medicare in private practice doesn't allow us to see more than one patient at a time anyway. So other insurances do. So that's why in a therapy clinic, you'll see multiple patients per therapist. But I think Medicare sees that it's important that, if you're over 65, you need that one-on-one attention. So, and that's what we do with all our patients.
That's remarkable. I wish I could go back and get that therapy all over again. I want a refund.
But you're young, so you're pretty able to do things on your own. A lot of our patients really need us to help them.
Compliments will get you everywhere. Truly, thank you very much for that compliment. This is not young, but compared to the people that I work with, I'm probably young. But okay, so OT is physical, and that's bending, manipulating.
That's more PT. PT is more
physical.
Yes.
PT. I have dementia, so you can work on me later. So that's all the physical stuff, and the objective there is to get rid of a pain or improve movement.
Yeah, improve movement. Oftentimes balance is a big issue with seniors.
Balance is part of PT.
Yes, balance is it's part of OT too.
Yeah.
So oftentimes people, if somebody's gone to the hospital, went to skilled rehab and go back home, they're going to have both OT and PT. PT will focus more on the strengthening, the ambulation, using the walker properly, that kind of stuff. And OT will focus more on the self-care training, so making sure they have the proper adaptive equipment in their bathroom, the grab bars, that they're doing things the proper way.
All the accessibility stuff.
Yes.
That's intriguing.
So that's the OT that would address the adaptive equipment. And
a lot of the times we'll do like a home safety kind of a checklist and go through the home and make sure that everything's set up safely, make sure they've got a seat in their shower if they need to, they've got, like Natalie said, the right grab bars. But also if balance is impaired, then that's going to affect their function, completing their morning routine.
A thing in the shower, a seat in the shower.
A seat in the shower. Did I say thingy?
Is that a brand, the thingy brand?
There's many brands, but there's a tub seat or a tub transfer bench.
I love it.
All kinds of jargon.
So I'm losing my train of thought, but that's okay. The balance thing, there's a program out there called Matter of Balance, which some people teach. Is that the same thing or different from what you teach?
So Matter of Balance is not really done by therapists. I think people are trained from the from SMA, Southern Maine Area Agency on Aging. So if somebody needs, and they're like group exercise programs, which, they're really good. So for those folks who are able to attend a group and don't need that one-on-one, it's a great option. So the people we work with are the people that need one-on-one, that have shown a decline and need to get back.
Shown a decline in balance?
Yes. So if people want to prevent the decline, they can go to those groups. And if you let's say you've had 3 or 4 falls, and then you really need PT intervention to get you back to where you were before you fell, and then you can continue with those programs. Yeah.
Now, if you just have problems with balance and haven't fallen, you should probably go see a doctor first, and then the doctor will say you need to have balance.
Because sometimes sometimes it's not really a physical condition. It can be a inner ear, or it can be there can be different things that would lead people to fall. So
I've always had a problem with balance, checkbooks, bank accounts.
So an OT could help with that.
I can actually help you with that.
Actually, we're joking, but it is true. So OT would also help with that kind of stuff. If somebody used to be able to balance their checkbook and they've become more disorganized because, I don't know, they had a UTI and with resulting confusion, then you can help people get back to those.
B12 deficiencies can cause confusion, and there's a lot of things. I refer to them as the other 49 forms of dementia, but there are a lot of things that cause that confusion, including just something as simple as stress.
Right. Even a change in environment can sometimes be overwhelming for somebody too. So we can go over that stuff as well.
Exactly. So I think I understand PT.
Yes.
I'm still confused a little bit with OT, and I know, I've talked sometimes to Reggie Robnett, who is over at UNE
Yes,
in
yeah.
Portland campus, and at one time she wanted to help us with our memory cafes, and that may be something down the road. But there's a really good training program here in Maine to generate new OTs. Is there a shortage of OTs at this point, or a surplus, or?
I would say right now there's a shortage in PTs. It's hard to
In
find.
PTs?
Yes, but we've been pretty good
OTs
with
are pretty good.
OTs and speech therapists for the
Okay.
last few years. Yeah.
Now, speech therapist is just for speech?
No.
Oh.
Yeah, so speech therapists really address speech, of course, but they also address like swallowing, and they do standardized cognitive assessment. So if you need to know where someone is at in their dementia and you want like really objective data,
Yeah.
they do those standardized cognitive tests. So they work a lot with older people.
Yeah.
And
When you
the
say standardized cognitive tests, are you talking about the mini mental exam?
No, that wouldn't be a standardized
Okay.
test. So mini mental is more of a screen. So that would take 15, 20 minutes to perform. But they do tests such as the ROS, the RIPA G. So I'm not a speech therapist, so I'm not an expert in the field, but they come up with pretty nice reports that really say where people are with.
How does speech therapy change swallowing? I know one of the problems with people who are beginning to get dementia is that food often goes down the wrong
They can have
opening,
aspiration, yeah.
and aspiration, and often the aspiration will lead to a bronchitis or even a pneumonia, and that's like the in some cases that's the beginning of the end, that pneumonia series. So I don't understand. I've never thought of speech and swallowing as the same.
Yeah. So speech therapists really would do swallowing assessment and decide, first of all, they would help determine which consistency like the patient should be on. So sometimes somebody is not able to have regular food, so they may be on a mechanical soft diet or on a puree diet. And sometimes it's with liquids. If people are taking regular thin liquids, they can aspirate, so they need their liquids to be thickened. So you have people on nectar thick liquids, or even thicker than that. So they make those recommendations as to what the diet should be, and they also work on strengthening those swallowing muscles.
Oh,
So
okay.
they do what's called vital stim therapy. So it's basically like what e-stim is for physical therapy, trying to strengthen the muscle by giving like electrical. Small little
TENS unit?
electrical stimulation, like a TENS unit, but for that you apply here on the on those muscles.
Remind me to stay away from your speech
Yes.
therapy. That doesn't sound
And
right.
it is quite effective. I mean, because we've had people that were on mechanical soft diets, that were on thickened liquids, that after they've gone through the vital stim therapy, they're able to go back to a normal diet. So.
Interesting. Selena, you're the I would assume the lead OT. You're here.
I don't know about the lead, but
So talk to me. Do you have a sample, an idea of what somebody you've worked with, and the reason for working with them, and the end result, without naming names?
I'm trying to think. A lot of our patients, we have a lot of dementia patients. Then we'll also have, patients with strokes or something like that, or brain injuries. So we do a wider range of patients. But for instance, if somebody has a brain injury, they come over and they present. It's interesting, really. They have like a right-sided deficit or a right-sided neglect or something like that. And so with OT, we'll work on focusing on making sure they're safe in their environment. If they're unable to ambulate, we'll work on getting them the right wheelchair to fit for them, including all the accessories and stuff to make sure it fits them properly. Making sure they're safe transferring in their environment.
What is the desired outcome? With PT, you're hoping they'll be stronger, better balanced, better something. Right. What OT, you're hoping they'll regain certain percentage of their functioning?
Everyone's different. That's kind of an open question because everybody's different. So depending on how they are at their prior level of function, that's what we want to get them back to. So getting them as independent and safe as possible.
Okay, so you're shooting for 100% return to original condition.
If it's appropriate, yeah.
But I mean, that doesn't, like a car accident or some of those things, you're not going to get back to original sometimes.
Sometimes you
Strokes
won't, and
are
then, right,
often
depending
have
on the
leftover.
level. Yep, and so if we're working, if somebody comes over to us and their end goal is to return home with 24-hour supervision or returning home with somebody coming in and just preparing their meals for them and checking in, then we'll tailor their program towards those goals.
You don't do the coming in and checking the meals and stuff. That's a different agency.
Yeah, we can help them if a goal is for them to be able to prepare their own meal. Then that's a goal that we can have. Oftentimes somebody's like, I really want to be able to cook my own dinner. I don't want to depend on somebody to do that. And so I'll take them into the kitchen and we'll work on steps leading up to that long-term goal. But yeah, everybody's different. It's what's important to them. So some people really don't care about making their own meals, and some people, they want to be able to get in and out of their car safely or something
How
like
many
that.
people do you have? How many employees do you have?
We altogether we have 28 now. 28 employees, probably 4 or 5 in the office. So over.
And they're
20
almost
therapists.
always out in the field
Yes.
doing
Yep.
something. Although you do have a space in your office
Yes.
where you can treat people if they come to you.
Yep.
So Natalie, you're the owner of this business, and how long have you been a PT?
I've been in OT since 1995.
Okay.
So for a long time.
So since '95. So, and you're an OT, but you got into the complete rehab field.
Yes.
How does somebody go from getting a college degree in OTD masters?
I have a master's, but when I went to school like a long time ago, all we needed was a bachelor's degree. So, and when I moved to the U.S., actually in New Hampshire, maybe I think 10 years ago, I went back for my master's. So I have a master's in healthcare management.
Oh, HCM. So how did you? I mean, there's a lot of OTs out there who don't start their own business. But why? Where did you get the courage to do that? Because there's a lot of kids who are.
I guess I always like to be a little bossy, so my family says.
Lena wants to start her own business when she
Right.
gets back from leave.
Yes.
And so,
She's due soon.
No,
by the way.
no, I mean, that's a courageous step.
Well, yeah, but I think it was just a natural evolution for me. I always like to be in charge, I guess. And then I was a rehab manager in New Hampshire in different facilities. And when we moved to Maine, we just had the opportunity to start our practice. And
So
that was 10 years ago.
That couldn't have been easy. I mean, that would have been a very challenging time.
I think anybody who owns a business knows, it's a lot of work. I mean, you definitely have to sacrifice a little bit of personal time if you want to be able to be successful, but in the long run, it's very rewarding.
Have you gotten that personal time back yet? I mean,
I'm getting there. I'm going on vacation next week. No, I work
really?
hard but play hard. I like to work long days but then take some time off with.
the weekend is sacred.
No, not really. I work every
works every
Sunday.
Sunday, yeah.
Every Sunday. But I'm going. Yeah, I take vacation.
Do you take care of patients 7 days a week?
If there's a need, but that doesn't happen very often. Most people are seen Monday through Friday, or they're usually seen 2 to 3 times a week, but over. Yeah.
And rarely weekends. So it's basically a Monday through Friday job.
Yeah.
That's kind of good for people in the health profession because so many jobs are, you got to put in a weekend or an evening or some shift work.
I guess it depends where you work. If you work at New England Rehab or at Maine Med or Mercy, you probably need to do some weekend and be on call. But we don't need to do that here.
And did you ever work at Mercy or Maine Med or?
New England.
I'm at New England Rehab as a per diem therapist. I've been there for, I think, 4 years, just once or twice a month, just to kind of mix it up a little bit. And
yeah. And you end up working on a weekend?
Yeah, I do just weekends there.
Weekends.
Yep.
So, I mean, because I hear a lot from people in the health profession who are just kind of get into this cycle of shifts, working the night shift and the weekend shifts, and you have one weekend off, and the next weekend you're on, and then one weekend off, and next week you're on, and the days you get off are not always the ones you want.
Yeah,
So
we're pretty lucky as therapists. Usually, most therapists have Monday through Friday, and we kind of make their own hours, which is nice. So you can work from 7 to 3, 9 to 5, or 8 to 10, depending.
Very
So
flexible.
what is the hardest part of owning your own business right now? where you're at. You've had what 9 years of success,
Yeah.
and gradually building. You're not folding up tomorrow and closing the doors and moving to Nebraska or something.
No, I think for us, we never wanted to grow too fast, so it's just been a natural progression. So I think sometimes you just wait for things to fall in your laps a little bit. We've always kind of focused on good customer service. We know that's really important because there's a lot of big companies around us, so we're really trying to give our patients the best possible, so they'll be happy and come back, and they'll tell people around them what we do.
There are a lot of other companies that are doing OT, PT.
Yeah, there's different home health agencies, and there's obviously the outpatient clinic, so people have a choice. They go to.
So it's a pretty competitive field.
That's healthcare is somewhat competitive, but everybody is so nice and works well together, so
Good.
that's good.
Good. Selena,
Yes.
how did you get into being an OT, and what on earth brought you? I mean, when I was in high school, I knew I wanted to try to get into medicine, but I couldn't figure out which one of the many choices up there. I mean, my dad wanted me to be a radiology technician because he taught the radiology school at Maine Med back along. And I know that would have brought good money and stable money, and anywhere I went, I would have been in demand. Is that pretty much the same for the OT profession?
It varies. When I was younger, I had surgery. I had a back surgery.
Oh.
And so that's when I knew that I wanted to be in the medical field, similar to what you were saying. I just didn't know what. I just really liked working in that kind of a setting. Being in that kind of a setting. And then when I was in college, not knowing what I wanted to do my first year, I substitute taught at the local elementary school. And I had like a couple 2 to 3 week long substituting job as an assistant helping out the OT in the school. And ironically enough, it was in the school, and I haven't worked in the school system, but I knew I wanted to be an occupational therapist. And so then that's kind of where it went from there.
Where'd you go to school?
I went to University of New England right down the road, actually.
Oh, UNE, okay.
Yep, my undergraduate is from the Biddeford campus, and then I have my master's from UNE as well, but on the Portland campus.
And how did you get connected up with Natalie?
Natalie?
Coastal Rehab.
I heard wonderful things.
Really? No.
Yeah, no, I really did. Yeah, one of my good friends is a speech therapist for Coastal Rehab, and she had nothing but great things to say. And I had been working for another company for 5 years at the time, and I just loved what Coastal had to offer as a smaller company. And they had, my friend that worked there loved it.
So patients can often tell when an employee is happy.
Yes.
So, and that's actually a very key indicator for a patient that they're in good hands.
Absolutely.
If the employee is happy, that says a lot about how they're going to take care of you. So I compliment you on keeping at least.
Try.
Yes, we have fun. We have lots of fun.
Yeah, we have a really good team.
That's intriguing. No, that a lot of businesses lose sight of the fun part, and for a lot of people, when I worked at Maine Med in 2 different capacities. Early on as an orderly, which is a long lost term, but later as the director of finance at Maine Med, and people tend to forget about the fun part, and so it's important to include that in the day-to-day process. It's got to be a little bit of fun.
Absolutely, yeah. We have a good group of girls that I work with, and there's like 4 of us that work at Huntington Commons primarily, or in the Kennebunk area, and then we all get together for our meetings and our outings and stuff.
A meeting, a daily, a weekly.
We usually do a quarterly meeting for all the staff, so we can all get together, and then we do monthly meetings per area. So usually one in the Kennebunk area, one in Cape Elizabeth, one in Falmouth. So we have groups.
Do you do any education for the public? Do you have educational seminars or opportunities?
We do different things. Like in Cape Elizabeth next week, I'm doing a fall prevention program for the community through community services.
Through Cape Elizabeth Community Services.
Yeah.
Cool.
Yeah. So people are coming to our office.
Which you should be watching this on the Cape Elizabeth Public Access Channel, sponsored by
So we're doing that. I do a lot of training with different agencies, like doing back safety, that kind of stuff. And we do training at different facilities to the staff and also to the residents on different subjects. So we've done effective communication strategies for people with dementia. So speech therapists have done that. We've talked about our LSVT programs, which is our Parkinson's program. So we've done a lot of
Your LSVT.
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 Yes, it's hard to remember that term.
Now, this is a program that I think you're the only ones who I know of who offer this.
I know we were 2 years ago when we first got certified. We were the only ones certified to provide the LSVT BIG, which is the program that occupational and physical therapists.
LSVT
BIG, yes.
Okay.
Yeah.
Talk to me, or actually, Selena, you can probably tell me more about that.
LSVT BIG, it's done by either an occupational therapist or a physical therapist. Essentially, it was aimed towards patients with Parkinson's disease. Now it's aiming towards Parkinson's disease patients or neurological disorders or deficits. Essentially, what the overall picture is just focusing on making large movements, quality over quantity, big accentuated movements. A lot of times with patients with Parkinson's, they have like the shuffling gait, their voice tone lowers, which is what another one is LSVT loud. So with the BIG, we just work on accentuating movements, working on balance, posture. It's an intense program. It's 4 days a week for 1 hour each session, and it needs to be done within 16 sessions, yeah.
16 sessions,
there you go, for 4 weeks, I'm sorry. And so, but it's proven to be quite effective. We see really good results with it. It's structured exercises that you work on. It involves patients having homework, which is really fun.
Really?
Yeah, so they can kind of tailor and bring up specific goals that are important to them, like what I was speaking of earlier. If a patient's like, I just want to be able to put my coat on by myself, and we work on having that as a goal. Because a lot of times with Parkinson's, they have those freezing movements and stuff like that. So it's great. It works on.
So wait a minute. You brought in another factor which I haven't talked about, but tell me about Parkinson's. You seem to be one of the groups that are very interested in the Parkinson's. Mm-hmm. How does that tie into PT and OT?
Mm-hmm. Well, I first heard about the LSVT program like 2 years ago. I went to visit a friend who owns a PT clinic in Florida, and he was telling me about this program that he was certified in. I'm like, I never heard about it. So I went online, and nobody was certified in Maine to do the LSVT BIG at the time. So started looking into it, went to California, which was nice, 4 of us. And then I think we have like 11 or 12 therapists certified to provide it now. So how did we, okay, so people with Parkinson usually, like Selena was saying, have smaller movement. So basically their handwriting gets small, their gait gets smaller, and their movement, everything gets smaller. Even the facial expression, there's less facial expression if you have Parkinson's. So the whole goal of the BIG is for all this to change and be bigger. So you're more expressive, you're moving bigger, so you're not stuck like this. Your handwriting gets more normal, and your gait is more normal speed and amplitude. So it's pretty exciting. It's
okay. So that's on the PT and OT end of things, and the BIG comes from the big movements.
Yes.
Getting people, especially sounds like it's very focused on Parkinson's specifically because of the contracted movements, but. Does it apply to other diseases too?
It does. The research been done mostly for the idiopathic Parkinson's, but there's more and more like other conditions such as like supranuclear, progressive supranuclear palsy or multi-system atrophy that it would apply to.
I mean, everybody understands.
Knows what that is, right? It's okay if I made a little mistake here. So there's other disorders that it can be applied to. Like if somebody, I guess, if the symptoms are the same, you have smaller movement, shuffle gait, so you're targeting that amplitude of movement.
So it's any illness or disorder where movement has been
gets smaller.
Smaller or contracts in some way. I'm glad you brought Selena to explain that. Thank you very much. So you do. Do you have a Parkinson's support group?
Yeah, actually, Selena leads a group. I'll let you talk about it.
You do like to control, don't you?
There you go.
No, I lead a Parkinson's support group. It's the second Thursday of every month. We meet right at the Huntington Commons dining
Oh, down
area.
at Kennebunk.
Yeah, right off of Ross Road. And it's from 2 o'clock to 3:30. Like I said, the second Thursday of every month. And we've got a good group of people. Sometimes
very
we have
active group.
yeah. Sometimes we have up to 30 people. We'll just bring in different speakers. Every 3 meetings we have a gal from Aging in Place, and she comes and we split up, and so it gives the people who come with their caregivers a time to split up and kind of have those candid conversations that they may not feel comfortable having in front of one another. And so we have that. Just most recently, we had somebody come from AAA and kind of talk about strategies to do to make sure you're driving safely. Or
Really?
yeah, it's great. And so we have many subjects that we can broach upon and stuff like that. We have a lady coming, I think next month, doing yoga, who specifically does yoga classes for those with Parkinson's. So it's a great group. It's about an hour to an hour and a half, and we meet once.
And is that the only support group, or is there other support groups around?
There are other support groups. So we lead that one in Kennebunk, and there's one that we help lead at Ocean View in Falmouth.
Okay.
Yeah.
I didn't know if that was you folks or somebody
yeah,
else.
yeah. So we just, we're just like help coordinate things, and then obviously we choose what matters to the Parkinson's.
Do you work at all with COPD patients?
Mm-hmm. Yep.
Do you know if there's a support group for COPD around?
I don't know.
Maine Medical has a support group where they would do like cardiac rehab, and then they have a support group after you complete the rehab process, but I'm not sure of any details on
Because I've
it.
run into several people who have COPD, and this one particular gal out in Cumberland, who comes to our Cumberland Cafe, started one in Damariscotta when she lived there, but now she's down in this area. She's looking for a COPD support group.
Yeah.
And that's another thing, and just for our listeners, keep your eyes and ears open for support groups and learning opportunities, because there isn't a lot of money to publicize these things. And so it comes down to a lot of, from one ear to the next, by word of mouth. And you aren't going to hear about all of them unless somebody's got a lot of money to spend on advertising. And I don't know, how much does your organization spend on advertising?
That's a loaded question. I don't
It is.
know.
Well, no, it is a loaded question. I ask that because some organizations in Maine are spending 25 up to 25% of their budget just on
Yeah, we don't
publicity.
spend that much. No, we don't do much publicity.
Okay.
For us, it's mostly those direct relationship with physicians, social workers, discharge planners, and the nurses in different retirement communities.
So you mentioned BIG, and then there's also a LOUD program.
It started with the LOUD. So LSVT actually stands for Lee Silverman Voice Therapy. So that's what LSVT is. And it was named after Mrs. Lee Silverman. Yes. That's what it stands for. And it was developed in 1987. So it's been almost 20 years. And it's been heavily researched. And the research data shows really significant improvement with vocal loudness after people have gone through the program. So it is done one-on-one by a speech therapist. And it's really the single goal is to speak louder.
Okay.
So not to yell, not to shout, but really to work on
Was is that a physical manifestation that causes people to talk softer? But
yes, people
or
with
a
Parkinson,
personality
almost
issue?
all people with Parkinson,
okay.
almost everyone with Parkinson at some point will see changes in their voice quality. And oftentimes you have the family members say, it's really difficult for me to understand my wife, my husband. So, and that's how we get the referrals. And then at the end, it's pretty cool. You really see a big difference. Now they're able to be understood, which is huge.
Interesting. So I didn't realize that a softer voice is symptomatic of Parkinson's.
Yeah, very
That's
much
oftentimes
so.
one that you notice
First.
really. Yeah, and then the flat affect a lot of the time goes hand in hand.
And people, oftentimes, they lose you don't see their arms moving when they're walking
The arm
anymore.
swing,
The arm
yeah.
swing.
No kidding.
Yeah. So those are some of the first signs. I think loss of arm swing and the facial expression and the voice that gets
Because I know
softer.
with Alzheimer's and dementia, there's a variety of things that become that some of us know about that other people don't seem to know a lot about. But for example, with Alzheimer's, or I shouldn't say Alzheimer's, with dementia, Ringing in the ears is an early sign. The trouble swallowing is an early sign. There's just a variety of things that you can kind of pick up on. So you kind of lead the way, at least from the people I know that work in OT and PT, with this big and this loud program. And that has some evidence of better results.
Yeah, the Loud definitely has. They've been funded through the National Institute of Health, and there's been a lot of research done. And actually, there's even imaging studies that show changes in the brain after people have gone through the Loud. So it's pretty significant, and people that go through it, you really see a very positive changes in their voice. And not only their voice, actually a lot of people with Parkinson have trouble swallowing. So it actually helps with the swallowing because you're strengthening those same muscles, and it helps with facial expression as well. So ultimately it helps with confidence. If you're able to talk louder and you have more expression, you're more confident.
We're getting close to time to wrap up here, but if people want to know more, can they call you?
Yes, they can call us. Yeah.
And you're out in Cape Elizabeth. What's your number?
Our main office is in Cape Elizabeth. It's 767-9773. And our website is coastalrehab.me, like as in Maine.
Oh, .me. Interesting.
Yep.
Are you planning a coastalrehab.fla?
That's where I used to be, and I moved to Maine, so I'm happy here. I used to be FLA. Yeah.
And I just ask if you have any last thoughts that you'd like to relay. Have I missed anything? I will say from my personal experience, Natalie has been really good to work with and been really straightforward. I don't see a lot of gimmickry or things that you might see in other businesses. Not to say that there is, but just a straight on good person to work with and to be associated with. And Selena, this is the first time I've met you, but I wish you luck. You're due
May 6th, any day now.
Stay tuned for the next show. We'll be doing a live birth presentation, but congratulations on that. And again, thank you both for coming and sharing some knowledge. And if we get questions, I'll be certain to forward them to you. You can always reach us at MemoryWorks at info@memoryworks.org. I'm glad to help you learn more. We do this TV series. We're doing a blog in Bangor Daily News called Journey Through Dementia. The next issue of My Generation from Current Publishing is due out really soon, and this month's issue is specifically about dementia. But I do a column in that every issue, also called Dugan's Digest. And we got a whole bunch of other things on the table that if you'd like to become involved, either as a volunteer or we are still looking for board members. And then we've also formed this coalition. We call it the Dementia Care Coalition of Southern Maine. But we tend to always get into senior issues too because there's it seems to be a correlation between aging and some forms of memory loss. So we're here to answer questions. We're here to help you become aware so you can make informed choices. And so let me wrap it up by saying you're always welcome. And you can even join us in the studio when we do our recordings, which is the 1 o'clock on Tuesday starting in May. So come on down and we'll find a way to get you into the conversation. And thanks to these excellent guests and marvelous, I consider them young people, regardless of how old you are. I'm old. I'm not the oldest old, but we leave that to other experts. So thank you very much.
Thank you.
And thank you for watching this episode of Dugan's Digest. We'll see you next time with a different guest. Let's put it that way. Thank you.